Have you heard all the stories on TikTok about nursing homes closing because of Medicaid cuts? Nursing homes are closing because of Medicaid cuts. I thought you were trying to get rid of waste, fraud, and abuse. Well, look at this. Tennessee, this is an FAFO for you, the red state of Tennessee, who voted for Donald Trump and is now going to have up to 12 nursing homes immediately closed due to cutting of Medicaid. There are 78 million Americans on Medicaid, 20% of the population.
Guys, the effect this Medicaid cuts we have on everybody will be huge. Hey beautiful people, welcome back to my YouTube channel. Thank you for stopping by, supporting your girl on this channel. So all credit goes to the creators in these videos. And guys, in today's video, I want to talk about some of the effects this cuts will have, because those that voted for you know who are probably thinking that these cuts are just going to affect those seniors in those care homes that are being shut down, or those care homes that cannot afford because their Medicaid has been cut. But guess what? It's going to affect everyone, because you think this nursing home cuts just affect the elderly. Please think again, because when those beds disappear, right, the shockwave will hit everybody. Just imagine when a facility shuts down, right, or discharges residents. Those people don't magically disappear. They come home to you, their children, to your spouses, right? And imagine you having a full-time job. No, scratch that. Imagine you having 3 jobs, right? Paycheck to paycheck. You suddenly become a full-time unpaid caregiver, right? That means you quit your job. You can't even afford to quit your job because you are not going to be having funding. There has to be a source of income to sustain these new people you have in your life. You quit your job, you arrange your life, you carry the emotional weight round the clock. You have no training for what is going to eat you, and now they are just your responsibility. And look at the hospitals also, because I believe that here's the domino effect, because hospitals can't discharge patients who need long-term care because there's nowhere for them to go. So these beds stay full, the ERs get backed up, people with emergencies, car accidents, heart attacks, they begin to wait longer for help, and everybody's care just gets worse. Guys, the woman in the next video, when I watched that video, I read the comments. People are like, FAFO, now you see what you voted for. Let us say a story with our mouth. You hear the story from my lips. Let's keep watching, guys. I'll see you soon.
Okay, just found out this afternoon that the nursing home that my dad is in is ending their Medicaid contracts. And he has until September 15th to figure out what to do. And so I've just been down the rabbit hole to try to figure out why would a nursing home end their Medicaid contracts, because even though they lose money per resident, the majority of the beds are filled with Medicaid long-term patients. So why would you end those contracts? You have to be in financial distress, I would think. This isn't a nursing home that is anybody's first choice. Okay, you're only going there if you couldn't get in anywhere else, or there wasn't any room anywhere else. That's kind of how we ended up there. Plus, it's only like one of 2 facilities in Memphis that has in-house dialysis. And at the time, my dad started dialysis in the hospital and was really sick. He could barely move. I mean, he's able to walk now, and he's, it's a miracle what he can do now. But so we thought that would be, the easiest thing for him at the time. So, I mean, just going down the rabbit hole, it seems like this facility is in financial distress, maybe going to close. I don't know. the company that owns this nursing home owns 5 throughout Tennessee and Kentucky. It has an above average staffing shortage, nursing staff turnover rate. So at 55%, it's a 1-star nursing home. So, I mean, why else would you end Medicaid contracts? Maybe it's as simple as getting less money. I don't think it's because they're trying to restructure and make more money from skilled beds, because I'm telling you, that's not anybody's first choice. It's no. So yeah, can anyone enlighten me? Is this happening anywhere else?
Woman talking about her father getting kicked out of the nursing home. Well, apparently the nursing homes are kicking out their Medicare patients. And she was like, why would they do that? And everyone in the comments was like, honey, this is what you voted for. This is Medicare cuts. This is the big, beautiful bill. And she was like, no, that's not it. Yes, it is. I work in skilled nursing. 90% of the residents that are in there, they are Medicare patients. These buildings stay open because of Medicare. They will close down. They will not care for your aging parents and grandparents for free. They will send them home to you. You will have to quit your job and stay home and take care of them. That means you're going to have to be the caregiver for your father, your husband, your kids. You're going to have to quit your job. You're going to do all this on half the income for your household. This economy is going to suffer greatly when these places start closing down. This is one of the reasons, this is the main reason why I did not want to rely on the U.S. for my income while I'm living abroad. The economy here is bound to crash. When you cut Medicare like that and these places close, a lot of people are going to lose their jobs. The dollar is going to suffer. There is no forethought with these people. They have no idea what is happening.
Contracts. And he has until September 15th to figure out what to do. And so I've just been down the rabbit hole to try to figure out why would a nursing home end their Medicaid contracts.
So it's because of the big, beautiful bill. I'm going to save you the trouble of going through a deep dive. That's why this is happening. Because I don't think people realize that 65% of nursing home residents are covered by Medicaid. So what did y'all think was going to happen when Congress just passed the big, beautiful bill and Donald Trump signed it into law, which had nearly $1 trillion worth of Medicaid funding cuts in it? I mean, it's going to shift the burden of cost over to the states, and a lot of states are not going to be able to eat that cost without jacking up taxes or cutting other benefits, so they're going to cut Medicaid funding. And nursing homes have to respond to that. So the way they're going to respond is a couple of ways. One is they're going to just restrict the amount of Medicaid patients they accept into their facilities. Two is that they're just going to boot out already existing Medicaid patients to open up those beds for private pay patients so that they can still make money. Or they're just going to shut down entirely because they can't function without that Medicaid funding. Any of those scenarios is just going to be devastating to the vulnerable patient population that requires skilled nursing facilities for care. Those are elderly patients and disabled patients. And what's going to happen to those patients? You can't just throw them out on the street. A lot of them are just going to have to go back home and live with their families, who are going to have to figure out how to make that work, how to provide the skilled nursing care that they were getting at a nursing facility at home. A lot of patients who are in the hospital, who are ready for discharge, who would normally go to a nursing home, they're just going to be sitting in the hospital till we figure out a way to get them home safely. And that's going to cause a lot of delays in care because it's going to cause backup in the hospital, and patients are going to be waiting in the emergency room, and emergency room waits are going to be longer and longer because the hospital just can't discharge patients because they have nowhere to go. So this is a direct result of the big, beautiful bill that Donald Trump campaigned upon that was in Project 2025. And elections have consequences, and despite knowing all of this beforehand, a lot of people still voted for it. A lot of people who have elderly parents in nursing homes. So this is going to impact every single one of us. And I don't know what to tell you, but it's because of the big, beautiful bill. So.
But did she actually ask that question that she doesn't know why? Of course, it's because of the bill. And anyway, it's not as if she's going to come outside and say, yeah, I voted for this policy. Okay. At least some of them do actually have the decency to come out and say, oh, I regret my vote, this and that. I give those people their flowers though, because trust me, it's not easy to come out and say, oh, I was wrong. Now I know that I was wrong. I'm willing to make a change. It's not easy to admit you're wrong. So I give those people their flowers. But this woman, there was no place in her, previous videos or so where she actually said, okay, Amaga, this and that. But you trust people now. The comment section was full. They are like, this is what you voted for. Okay. Now back to those effects. This thing will make job loss a huge thing, because these nursing homes are not just care facilities, right? There are people there that actually take the paycheck from that care facility to their home and live on it. There are nurses, cooks, aides, there are janitors, and when that place shuts down, thousands of people lose their jobs. Dozens of people lose their jobs. Imagine a very small care facility in a very small town, right? If dozens of people lose their job from that care facility, that's like an earthquake in all those small towns. And you might think that, oh, this is not my problem. But just imagine your parents coming into your home, and let's say in the middle of the night they just develop a stroke. Okay, what do you do? Because the first thing is that you panic. You don't know what to do. So yeah, guys, this is not just about the elderly or these care homes. It's really bigger than this. Keep watching these videos.
It's happening. Did you guys see that woman talking about her father who got kicked out of the nursing home? That's not a random story. It's happening across the country. Just like we thought. Because of that wonderful, our big, beautiful bill, nursing homes are discharging residents who rely on Medicare or Medicaid because they won't be able to pay. Why? Because those programs are being gutted by funding cuts. Most of the residents are there because Medicare and Medicaid pays for their care. So without that funding, these facilities can't survive. They will kick people out. When the money disappears, they close. They don't care for your loved ones for free. They'll send them home to you. That means you quit your job, lose half your household income, and then all of a sudden you're the full-time caregiver. And then when thousands of caregivers leave the workforce, when nursing homes shut down, the economy takes a hit. This whole thing's not just about politics. It's about whether your parents, your spouse, your kids will have the care they need when they need it. People voted for this. Medicare and Medicaid cuts don't just hurt the elderly and the disabled. Believe it or not, they hurt every single one of us in some way.
Homes do not take Medicaid, Medicare, and haven't for years. You're right. But what about the ones that do? Because of the big, beautiful bill being passed, there are hundreds of nursing homes that do take Medicaid, Medicare, that are on the chopping block because of this big, beautiful bill. See, what you're doing is you're trying to minimize the situation into nothing. It's not a big deal. It happens all the time. It's kind of like that same vibe of when these people can't find someone to go live with, they're going to be put on the streets. And then when they're put on the streets and they pass away on the streets, you're going to be the one that says, homeless people pass away on the streets all the time. It's not a big deal. That's you. That's what you are going to be doing. If you guys are not minimizing the situation, you guys are pretending like it's not happening. I'm not you. I'm not living in your shoes.
Well, I believe I've said enough about this topic. It's not just about the elderly, right? It's about you. It's about me. It's about every single person that can need help tomorrow. Because, trust me, those nursing homes cuts, they don't just close door. Like, when you say close door, that's like a subtle way of saying it. They slam the door in everyone's faces. Okay? And we all are going to find out. Let me know what you think in the comment section about this video. And if you have found value, don't forget to like, share, subscribe, I'll see you in my next video. Please stay safe. Mental health is important. Ciao.